Okay, so are good mornings a good exercise choice for someone with lower back problems or lower back pain? Again, with anything, it depends. So first of all, let's understand what a good morning is. There are basically two variations that I know of with the barbell. So obviously number one is probably the most obvious, and that's to do a standing good morning. So from here, kind of similar to what we do with an RDL, we'd brace, soften the knees just very slightly. And again, we're trying to emphasize popping the hips backwards to stretch up for the glutes and the hammies. And then we have a seated version of that. Come down, same idea, lock your brace in, hinge through your hips, and back up again. Now, the difference between that and, say, for example, one of my hip hinge favorites, which is an RDL. Obviously with the RDL, the weight, whether it be a kettlebell, dumbbell or a barbell, is kind of in front of your center of gravity. So you come down here and you push in. What that does is going to make it a lot easier for us to overload the glutes and the hammies and the hips as opposed to the erectors. The point of our good morning, having the weight up here, as we create that lever from our hips all the way up, is our erectors here now have to work way harder to maintain our spinal position. So basically what we're looking at is, in terms of each client, again, it depends. What are your goals for that client? What's their problem? So most people I see have back pain not because their back is weak, but it's overused. So if I give them an exercise designed to target the erectors, probably not going to really solve their problem. What they need to do is they probably need to work more on brace control and using the hips to drive hip extension with hip hinging. So for them, being able to do strict RDLs and maybe even kettlebell swings it's probably going to be a better option for those sort of people. If, however, you know that your brace skill is solid and you know that your hip hinging, your glute control is solid, and you still feel the back is a bit of a weak component. For example, maybe in things like squats, as people come out of the hole, they might be kind of buckling forward a little bit and then coming up. So that might be an indicator that the erectors are kind of the weak link in the chain in that example. But what we need to be careful of is how people are bracing. Because quite often I find people, especially people who train quite a lot, they might have ingrained the wrong type of bracing cues and technique, which is leaving their lower back exposed and causing that problem that it appears to be weak erectors. So what do I mean by that? So when we talk about bracing, like say for example, we look at a high bar squat. So a lot of people, when you say to them, like, unrack the bar, I haven't even set a brace yet, they'll take a few steps back and then they'll look to set the brace here, and you say to them, take the slack out, or get yourself nice and tight. What a lot of people will do, whether they realize it or not, is they start to create what we call an open scissor. So if they feel a bit loose here, they take out a little bit of that slack by just tilting their pelvis forward a little bit and then trying to brace here. So what that does, it does make you nice and tight, it takes the slack out, but what you've actually done, or they have got a bit of brace on, is you've shoved quite a bit of the workload into your back erectors. And again, they're probably going to tap out way before anything else if you're using your core correctly. If, however, you're still in the rack, you lock in your brace properly by putting your ribs down towards your pelvis a little bit, brace, rack, step out, and by the time you're already here, everything's already locked in, you can already feel it in your brace. That's totally different, because really it's already in the right spot. So again, what we need to be careful of is, does that person actually have a weak back, or they tend to overuse it, particularly with their bracing technique? So you need to be sure that this bracing technique, so from here and locking the ribs back down to lock into here, is correct and not creating that kind of open scissor problem. Because if they're prone to getting that open scissor problem and you give them good mornings, guess what? They're going to ingrain that and make it even worse. So what are the signs that you might be using that open scissor? Basically, when you do things like deadlifts and squats, do you find your lower back is this kind of the limiting factor, or maybe the day after, do you feel a lot of lower back pain in those muscles that they've done a lot of work, because you shouldn't do. And also just generally people tend to hit a ceiling with their weights on things like squats and deadlifts, because they're overusing their back, and those erectors are going to tap out pretty quickly if they're doing too much work. But also when you lift, do you feel you're carrying the weight here and through your hips? If you don't feel like the weight's locked in here, chances are if you create that slight open scissor, you've put a bit too much workload into your back. Now, if you know 100% that the brace is solid, you can feel it locking here, you still feel like when you're fatigued, you kind of tap out a bit, almost like those sort of like stripper squats. We kind of do this a little bit as you come up. And that's the time to maybe look at good mornings to get some more strength in toes erectors. But you need to know that hip hinging and glute control is solid and you've got the correct bracing technique before you start to play with that. Because if you've got a problem with that kind of open scissor, you had that movement on top from a good morning, you're going to make it worse, not better. So best case scenario, your weights are just going to get stuck and your performance is going to get stuck. Worst case, you've just put way more workload for your back and that's going to cause a problem at some point. So again, right tool for the right person at the right time. What's the actual problem we're trying to solve? What does that specific tool, the good morning, which problem is that specifically designed to solve? And does that mean it's the right tool for that right person to use? Because if it's not, you might be better off with locking in brace, using the hips, using something more like an RDL to try and teach hip extension driving through the glutes and the hips a lot more than the danger of trying to like ingrain it through the lower back. So again, we have to understand the actual problem you're trying to solve and then pick the right tool to solve that problem.